Ever experienced a sudden, sharp pain in your knee after a twist or a hard landing? Could it be an ACL injury? This is a question many people ask themselves when faced with a knee problem. It's a common concern, but how do we know for sure? What are the telltale signs? Is there a popping sound? Does the pain intensify at night? These are all valid questions that need answers. Stay tuned as we delve deeper into what an ACL injury is and its symptoms. Before we explore the symptoms, it's crucial to understand what an ACL injury is. An ACL injury is a tear or sprain of the anterior cruciate ligament, ACL, one of the key ligaments that helps stabilize your knee joint. This ligament connects your thigh bone to your shin bone. Imagine it as a sturdy rope holding these two bones together, allowing your knee to move but also keeping it from moving too much. So how does an ACL injury occur? Well, it's not as simple as stubbing your toe or getting a paper cut. It often happens during sports and fitness activities that can put stress on the knee. Sudden stops and changes in direction, awkward jumps, or direct collisions, for instance. Picture a football player pivoting suddenly or a basketball player landing awkwardly after a jump. These are typical scenarios where one might sustain an ACL injury. Now you might wonder, who's more likely to get an ACL injury? While it can happen to anyone, athletes playing sports like football, basketball, soccer, and downhill skiing are at a higher risk. These sports involve a lot of sudden stops and changes in direction. But don't worry, casual joggers and gym goers, this doesn't mean you're completely off the hook. ACL injuries can also occur during everyday activities like stepping off a curb the wrong way or missing a step when going down the stairs. It's also worth noting that research shows women are more likely to have ACL injuries than men. Scientists believe this might be due to differences in physical conditioning, muscular strength, and neuromuscular control. Other factors that may play into this include differences in pelvis and lower extremity, leg alignment, increased looseness in ligaments, and the effects of estrogen on ligament properties. Now that you know what an ACL injury is, let's discover its symptoms. The first symptom of an ACL injury one might notice is a popping sound. Now, this isn't your everyday kind of pop. It's a distinct sound that echoes through your body, a sound that is often accompanied by a sudden, sharp pain. This popping sound typically occurs at the moment of injury. Imagine you're on a soccer field, going for a swift turn, and then pop. That's when it happens. This popping sound is your body's alarm bell, signaling that something is wrong. It's your body's way of telling you that your anterior cruciate ligament, or ACL as we commonly know it, has been stretched beyond its limit. It's a warning that the ligament has possibly torn or ruptured. But what does this popping sound really signify? It's a clear indication that your knee has sustained a significant injury, likely affecting your ACL. It's a sound that shouldn't be ignored. The popping sound is just the first sign, but there are more symptoms to be aware of. One cannot talk about ACL injuries without mentioning the persistent pain that comes with it. A key symptom of ACL injuries that we simply can't ignore is the persistent nagging pain, which can range from a dull ache to a sharp, unbearable sensation. This persistent pain may not present itself immediately after the injury. Sometimes it may take a few hours or even a day or two to really set in. But when it does, it's not something that can be easily brushed aside. It's a pain that, like an unwelcome guest, overstays its welcome. The intensity of the pain can vary greatly from person to person. For some, it may just be a mild discomfort, a slight inconvenience that's easily forgotten amidst the hustle and bustle of daily life. But for others, it can be a crippling pain that makes even the simplest of tasks seem like monumental challenges. The pain is often aggravated by physical activity. This means that tasks you once took for granted, like climbing stairs, jogging, or even just walking, can become painful ordeals. The pain can make it difficult to fully extend or flex the knee, limiting mobility and making it hard to lead an active lifestyle. But it's not just the physical activities that are affected. The persistent pain of an ACL injury can also take a toll on your mental and emotional well-being. It can lead to frustration, anxiety, and depression as you grapple with the limitations imposed by your injury. Despite the discomfort and inconvenience, it's important not to ignore this persistent pain. It's your body's way of telling you that something's not right. It's a red flag, a warning sign that you need to seek medical attention. And while it's a symptom that's often associated with ACL injuries, it's not the only one. Persistent pain is a clear sign of an ACL injury, but there's more to it. Pain, while a significant indicator, is just one piece of the puzzle. In the next scene, we'll delve into another key symptom of an ACL injury, the dreaded night pain. Stay tuned as we continue to unravel the mysteries of ACL injuries. Night pain, a symptom that can disrupt your sleep and is a clear indicator of an ACL injury. This particular symptom is as disruptive as it sounds, putting a damper on your restful nights and making it a challenge to get the sleep your body needs to heal and rejuvenate. Let's delve a little deeper into understanding night pain. It's an intense discomfort that tends to occur at night, usually when you're lying down. The pain can be sharp or dull, but it's usually persistent enough to keep you awake or wake you up from your sleep. The stillness of the night can make the pain seem even more pronounced, as there are no daytime distractions to take your mind off it. The onset of night pain can occur immediately after an ACL injury, or it may develop over time. It's often a sign that the injury is more severe than initially thought. This is because during the day, your body is busy with various activities. But at night, when you're trying to rest, your body focuses on healing, and this can amplify the sensations of pain. Now, why does this happen? Well, the body's natural response to injury is inflammation, which is a kind of protective response. However, when you're dealing with an ACL injury, this inflammation can contribute to night pain. It's your body's way of telling you there's something wrong that needs attention. So, how does night pain disrupt sleep? Imagine trying to sleep with a persistent nagging pain in your knee. It's not easy. It can cause sleep disturbances, leading to a lack of quality sleep. This, in turn, can impact your overall health and well-being, making it harder for your body to heal from the injury. But it's not all doom and gloom. There are ways to manage night pain and improve your sleep quality. These can include everything from pain management techniques to adjusting your sleep position or using supportive pillows. Night pain is another significant symptom of an ACL injury. But remember, these symptoms vary from person to person. It's crucial to listen to your body and seek professional help if you're experiencing persistent night pain. Now that we've explored the symptoms, let's summarize them. An anterior cruciate ligament, or ACL injury, is an unfortunate event that can happen to anyone, whether you're an athlete or simply going about your day. The symptoms of an ACL injury are distinct and can be quite alarming if you're not familiar with them. The first symptom that we discussed was a popping sound. This sound is often the initial indicator of an ACL injury. It's the sound your knee makes when the ligament tears. It can be quite startling, especially if you're in the middle of an activity or sport. Often, it's accompanied by an immediate sensation of instability in the knee, as if it's going to give way. A key symptom of an ACL injury is the inability to continue activity. After that popping sound, you're likely to find it difficult to keep moving, particularly if you're engaged in a sport or exercise. The knee may feel weak, and you might notice a decrease in your range of motion. This is your body's way of telling you that something is wrong, and it's crucial not to ignore this sign. Swelling is another common symptom of an ACL injury. The knee may begin to swell within a few hours after the injury, and this swelling can be quite significant. It's a result of blood rushing to the area to start the healing process. Swelling can cause discomfort and further limit your movement. Now let's talk about the dreaded night pain. This can be a clear indication that you've sustained an ACL injury. The pain can be quite severe and often intensifies at night. It's not the kind of pain that goes away with a simple painkiller. It's persistent, and it can make it difficult for you to get a good night's sleep. In some cases, you might also experience a loss of full range of motion and discomfort while walking. You might notice that your knee doesn't quite move the way it used to, or that you feel pain when you try to walk or even stand. And of course, let's not forget about the bruising. This is caused by blood from the injured ligament seeping into the surrounding tissues. It might not appear immediately after the injury, but when it does, it's another clear sign that you've likely injured your ACL. Understanding these symptoms is your first step towards dealing with an ACL injury. Remember, if you experience these symptoms, seek professional help immediately. Listen to your body, don't be a hero, and if something feels off, get it checked out. Remember, consult a healthcare professional for proper diagnosis and treatment of any knee injuries. Thank you for watching. If you enjoyed this video, give it a thumbs up, subscribe to the channel, and hit that notification bell so you never miss a video.